Welcome back to the Mind Body Project. Thanks for taking a little time to join me today. I'm excited about the new year. A lot of times, the new year we talk about fitness and exercise and all of our New Year's resolutions. And as in my episode last week, I talked about this month kind of concentrating on mental health, mental wellness for the month, and because that has a big impact on our well-being and our year. And I think sometimes we miss that. So today I have a guest. We've known each other for a long, long time. She has a bachelor's degree in social work, a master's degree in clinical medical health. She has certification and license as a licensed professional counselor associate. She has a supervisor, Dr. Tara Fox, PhD. She's her supervisor. For the last, I guess not last, but for 5.5 years, she worked at a social, I'll get it out, in a community mental health.
Yes.
And has now switched to doing clinical therapy in outpatient with substance abuse and mental health issues. So please welcome my friend, Monica DeLeo. Thank you, Monica, for joining us.
Hey, I'm excited. I'm very excited.
So this is your first time to do a podcast?
Yes, it is my first time to do a podcast.
And so when we first got to know each other, you didn't have any of these fancy titles, any of these initials, any of that stuff.
Yeah, nothing.
Nothing. You were just...
I was maybe 18?
18 or 19.
18 or 19, and I'm 30 now. 30.
So I've had the privilege of seeing you go through this journey and grow into your field, into what you want to do. So we're going to get into mental health because I think it's so important. You and I both agree on this. If you watched one of my episodes last year, I talked to Michael Bell about physical fitness and diet and all that. And so that to me is, I can kind of geek out on that. And so I can kind of do the same on this. So Monica and I are going to try really hard to keep it not hours and hours and hours because we can both talk on length about this. So I kind of wanted to dive into, first of all, Monica, I said that, you do have a supervisor. You have a certification licensed professional counselor. What does that mean?
So a lot of people probably don't know, but when you get your master's degree in clinical mental health counseling and you take your exam to graduate, then you take your licensing exam, they don't just throw us out into the world and say, here, go do therapy, good luck. They keep us monitored for a little bit. And so what that means is that we find a supervisor who watches us for the first 3,000 hours, which is non-direct and direct clinical time. And I was fortunate enough to have one of my professors from Midwestern State agree to supervise me. And so what that means is that we meet for about 4 hours each month, and we go over cases. She checks in with me, seeing how I'm doing here at my job, any questions, concerns, and she's just making sure that I'm on track to be the best therapist I can be. And then once that's finished, then you lose the associate title. So right now, I am a licensed professional counselor associate because I'm still in those first hours. But in the next few months, I will be fortunate enough to drop that title, and I will be out. I know. It's
so all your 3,000 hours will be done?
Yes, I should have those done in the next few months. And so at that point, you reapply for licensure. You get a new licensing number, and then I'll just be an LPC at that point. There's no associate. There's no need for the extra supervision. I'll be free to do kind of whatever at that point. But I think it's important because while we learned so much in grad school and an internship, there's still so much to learn still. And so I think that it's good that they do that to make sure we're learning and we're not doing any harm since we are still kind of new. So I'm very fortunate to have Dr. Fox because she is one of the smartest people I know. And I'm not just saying that because she signs off on my hours. She really is amazing, and I've learned a lot from her. So that's probably something most people don't know about how to become a counselor or therapist, is that we have to be observed for about the first year and a half that we're out in the field before we can become fully licensed.
It's not you get out of grad school and they say, there you go.
Yeah, no, it's definitely not that simple at all.
Because, I mean, it really is a complex issue that you're dealing with.
Absolutely.
Um,
Absolutely.
So it is a complex issue, and we hear, even more so a lot, we hear about mental health so much more than we used to.
Hmm.
I think with even in the last couple of years,
Oh, yeah.
it's addressed. We hear it everywhere, whether it's social media, whether it's in the news, all over the place. But I don't know if we hear the word mental health, but I'm not sure if we know what it means. What is mental health?
So you're right. We hear mental health, and I don't know. We just kind of assume it's everything. It's all of it, which is not necessarily wrong. But the term mental health is basically your overall well-being, your emotional, your social, your physical, all of that. But some people get that mixed with mental illness, which they're used interchangeably, but they don't mean the same thing. So when we talk like mental illness, which is really a term for mental health diagnosis, that's when you kind of get into the nitty gritty of certain symptoms, certain characteristics, and certain diagnosis, like your anxiety, depression, that sort of thing. But mental health overall is just that general well-being. How are you thinking? How are you feeling? And one impacts the other, but you can be struggling with mental health and not necessarily have a mental health diagnosis. And you can have a mental health diagnosis and still have good overall mental health. And so it's kind of confusing, especially to people who aren't necessarily in this field. But I think especially for today, just going over mental health in general it's a lot easier sometimes for people to understand instead of getting into like the thick of the other topics.
And how big of an issue do you think mental health is? Do you everybody has it or needs it or has issues with it at some point? Or
I think that mental health, I mean, we have it through the longevity of our life. We can, as kids, it can be good. It can change as adults. It fluctuates. But when we look at when it gets to really impact people, and I pulled up a statistic because I'm a numbers girl. Even though I don't like math, it's kind of ironic that I'm still a numbers girl. And NAMI, which is a great website for people who want to get real good information, which is the National Alliance on Mental Illness. They say that about 52.9 million adults in 2021 suffered from some kind of mental illness. And so they say about 50% of all lifetime mental illness begins by the age of 14 and about 75% by the age of 24. So it really, I mean, I can't say it impacts everyone, but it's kind of close to home.
And that's it. And that's speaking of mental illness.
Yes.
So do you think mental health is broader and more people have issues more with mental health than just an illness was a diagnosis? Or
yes. So illness is the diagnosis, and where that specific criteria is. But that could also include those who have had something traumatic happen and then they work through that, or someone who's had some anxiety because of a job change, so they go into therapy to work through that. And so those numbers are fairly large because it includes even the acute care. And so I think that mental health impacts everybody as a large, because we can have good days, we can have bad days. And so when we look at mental illness, the number, while it's large, it could be even larger because there's going to be all of those other undocumented, unnoticed things as well.
And do you think mental health and being diagnosed into mental illness, do you think a lot of people don't seek treatment for mental health issues? In other words, do you think that sometimes they think, well, that's just the way I've always been, that's just who I am, without ever going to see a therapist, a counselor? Do you think they just
absolutely
try to deal with it?
Yes. I mean, and there are times where dealing with it on your own is manageable, and you can do that, and there's nothing wrong with that. If it's like, oh, my job's been really stressful, you get kind of overwhelmed, maybe that is something you can take care of on your own just
Mhm.
fine. But even if that were the case and you reached out to a therapist and you were just there for about a month or so till you work through that, great too. But I think there are plenty of instances out there where they do try to handle things on their own, or they say stuff. I've heard that plenty of times here. Well, I've always been this way. When we talk about certain things, and I'm like, well, how long have you been experiencing this? Oh, I've been this way my whole life. And it's like, oh, okay. And so sometimes they just chalk it up to that's just how I am. And for
Mhm.
those that feel like they're functioning well, then they just keep going that way. And so I think it's just really about looking at, is it affecting your life in any areas? And normally, once it starts really impacting those areas of your life, that's when the people decide to reach out for help.
And do you come in contact with people that say, this is the way I've always been, I'm handling well, I don't need to change? And you see those people that are like, well, it really is affecting your life. And they don't recognize it.
Yeah, I do think I've seen that. We've had spouses come in together, or one spouse is, I guess, wanting the help, kind of being pushed toward the help,
Hmm.
maybe, so to speak. And they're saying, well, I've always been this anxious, or I've always handled things this way. And so I don't think much of it. And then you have the other spouse saying, well, this is too much.
Hmm.
They don't see it the way I do. Um, and so I do think that sometimes maybe we don't see it within ourselves
Hmm.
that it's impacting others or impacting our lives, and not as much as maybe other people do. And some people come into therapy and they don't want to change. And that's a challenge in and of itself. And some people come and they eat up every second of it because they want it so badly.
Hmm. They want to make a difference.
Absolutely, yes.
And why is it, we talk about physical fitness and exercise and wellness, and we know why it's so well,
Mhm.
and why it is so important. And I think I know some people might have a hard time with mental health versus physical health,
Mhm.
because physical you can see.
Yes.
I can get up and down better. I can move better. But mental health, we can't see it. So I think sometimes we think, yeah, whatever. You know,
Out of sight, out of mind, right?
yes,
Mhm.
yes. So why is mental health so important?
Well, it's important. I can think of a million reasons, but I don't want to keep you all night. But really, the biggest is if we don't feel good, if we aren't doing well, we can't show up for ourselves or our families or in our careers. And so I always tell my clients, you can't pour from an empty cup. If we're empty, how do we continue to pour into others if we're not giving anything to ourselves? And so a lot of people kind of don't realize that, because some people give, and they don't realize that it takes so much from them. So if we're not healthy, we can't do those things, or we're not enjoying those things that we typically would, or showing up in ways we typically would.
So how do we, because that's a very challenging thing when we
Mhm.
say we have to fill our own cup before we can pour out.
Mhm.
How do we not be selfish? I mean, some people are saying right now, well, that's selfish to take care of you first, especially if it's a mom or a dad
Mhm.
or a significant other. Well, I want to take care of my spouse, or
Mhm.
but yet I'm hearing take care of me first, but this other person needs so much.
Mhm.
How do we prioritize ourselves?
Well, that's a whole learning thing. That's what we teach people in therapy, is how to prioritize themselves. And a lot of them do say, well, isn't that selfish? Or I don't want to be perceived as selfish. But we still reiterate back to, but if you are feeling empty, if you are feeling depleted, if you don't have much left, then how are you truly showing up for others? Because sometimes they're not.
Mm-hmm.
If their family needs something but they're exhausted, because they haven't been doing self-care or certain other things, then maybe they are showing up but not to their fullest potential.
Mm-hmm.
And so, the way I always like to tell my clients is that you're still showing up for them even if you're taking care of yourself, because then you can give to them even more.
Mm-hmm.
because if our mental health isn't good, our physical health isn't good. I mean, none of it is good. And so we just really push that it's not as selfish as it sounds. And maybe for those who give too much to others, maybe it's helpful for them to just be a little selfish. I mean, we're not slamming the door in people's faces, but there comes a times where you have to set a firm boundary that you need to take care of yourself.
And it's a process to get there,
Absolutely.
right? It's not just overnight, I'm going to start taking care of me all the time. It may be a little, what's if somebody's struggling with, I'm feeling selfish, but I know I need to prioritize myself, myself and take care of my mental health. What's one small thing they could do that could start them in that right direction?
That one is tricky because I think everyone is different. So I would probably ask them, well, what is the most important things in your life that you feel you're neglecting right now? And then, we would go through that and maybe make a list of all those things they're neglecting. And then we would narrow it down to one thing. And so maybe it's they're giving to everybody, but they're not, they're not getting enough sleep, or they used to go on daily walks and they really liked it, but they're not now. So then we would figure out how can you carve out that time to maybe if you don't feel you can do that every day like you were, then how can we get it done maybe a couple times a week? And, we work sometimes on those small tweaks to help stay consistent. Because one of the things you talk about is consistency and balance. You want things to be maintainable. And so in therapy, when we finally get to the point where we've already processed certain things and we're to the point where we can set those good boundaries, start those routines, we say the same thing. We want it to be maintainable, especially over a long period of time, because we don't want anyone to set themselves up for failure.
And do you feel that people struggle with self-awareness? Or do you think that most people are very self-aware? Or do you think that is something that has to be, as they go through the process of therapy, that they discover more self-awareness? Because like for me, I know one of my mental health things is rest. If I don't get enough rest, I can't think clearly. I'm much more cranky. I'm more apt to do things I would not normally do. But I think that it has come over time that I've been self-aware of that. Otherwise, I might just think I'm just cranky today. But when I look at my day, like, well, I didn't get enough sleep, or I can't figure this out or do that, it's because of a rest. Or I can't have the thoughts. Because I definitely, when I'm rested, for me, I have much better thinking, much better clarity.
Absolutely.
Some people can probably maybe do it on less rest, but maybe I need a little more. So how self-aware do you think people are in general? And that's hard to generalize.
That is. I was like,
but so do you come in contact with people that are? Do you feel like people who come in contact are more self-aware, or like majority of times they're not very self-aware?
Still struggle to answer that. Well, I think that depends, because when we look at mental health, it just depends. You have good mental health, right? If I don't have enough rest, I'm not going to get these things done. But sometimes in my field with the clients that I see, they might be self-aware to know that they don't feel well, that they're tired, that they're cranky, that they're irritable, that they're anxious. But maybe they haven't got to the point where they know why, or that they can really truly see the things standing in their way or the stuff that's happened to them that's making that such a struggle. And sometimes they know, and it's just still a struggle to get it done. So we've had clients who are extremely self-aware that can come in here and be like, I know that this is happening because of XYZ. But yet, progress still isn't being made. And so I think self-awareness, while it's helpful, people can still have it and still struggle to get those needs met. And so it's therapy in a whole is an adventure, because everybody is different. Every case, everything is different. So sometimes it's hard to generalize it. And sometimes you can you see patterns and things, and you learn from that. But self-awareness, I would say most of the people right now are very self-aware,
Mhm.
and they know what's going on. They know they don't feel well. They know something needs to change. But then there's these other things that are kind of roadblocks getting in the way to that.
Do you feel majority of people could benefit from therapy?
I think that, I know it's funny because I was listening to a podcast about this the other day, and it was kind of had my mind turning. I think that therapy might not be for everybody, but I believe everyone can benefit from therapy,
Mhm.
if that makes sense,
Yes.
you know. And I mean that, whereas some people might not need it for very long,
Mhm.
you know, kind of going back to the things that most people might be able to relate to, like a stressful job or even grief.
Mhm.
We get a lot of referrals for grief
Mhm.
with people who are grieving. And sometimes those people don't have to be in therapy, as long as, you know, somebody with very, very significant trauma. Not that grief isn't, but maybe they are able to process it, you know, quicker than the other. And then, you know, we're shifting into a time where a lot of companies have like the employee assistant programs where they offer a certain amount of therapy sessions to their employees because they're aware of the fact that burnout happens, stress happens.
Mhm.
And so I think everyone could benefit from it, but it just depends on the person too, because when they come into therapy, it's really about making a connection with your therapist. You know,
Mhm.
do y'all get along well? I mean, that's not to say we're not going to press buttons, because
Mhm.
that may happen,
Uh-huh.
but it's kind of, I don't know, kind of like shoes. When we like shoes, you need to find one that's a good fit. And so, you know,
And so
wow.
there's nothing wrong with, because there's also, I mean, now we have, I don't know what, you can do it on the phone. You can Skype
Oh
with
yes, yeah,
therapy.
like televideo and
Yeah.
all that. Mhm.
So there's nothing wrong with trying out a therapist
Mhm.
and saying, you know, we're not a good fit,
Yes.
and moving on.
Yeah. I would recommend you don't do that after one session, though, because normally first session's a little awkward,
Mm-hmm.
kind of getting to know each other. Most of the time, we're gathering background history, you know, painting a picture of what's going on, and so that can be uncomfortable.
Mm-hmm.
But you know, after a couple sessions, if you just feel like it's not a good fit and you're not truly connecting, then, you know, it's best to also let that therapist know, so that
Mhm.
way they can help refer you to someone who might be a better fit. But there's nothing wrong with being like, this is not working out for me. I need to try something else.
And it's not that therapy is not going. It's not for me.
Mm-hmm.
It's just maybe that person connection wasn't for you.
Absolutely.
It's like saying, as a personal trainer, I've had clients that we're not a good fit.
Mm-hmm.
It's something we just don't connect.
Yes.
And it's okay to say, I'm not right for you, you're not right for me.
Mm-hmm.
And we move on.
Yeah.
And I think about therapy, and when we say therapy, we're talking about mental therapy.
Yes.
But we think nothing if somebody goes to physical therapy.
Exactly. Yeah.
Because why are they at physical therapy? They're at physical therapy for that therapist to help them come out better and stronger than when they came in.
Mm-hmm.
And I think of that same way as mental therapy. The patient client is there to come out better and stronger than they were before. And the therapist is there to guide them through that process, because it's a very challenging process.
Yes. Yes.
With a lot of, and why not get a professional to speed the process along?
Mm-hmm.
Because it makes it so much better and can direct in a way that you want to go. What are some maybe some tools or techniques that can help assist in improving mental health?
There's so many.
There's a lot.
There is so many.
Like what's a top 3 or 4?
So, you know, we talk a lot because where I work, we do individual therapy. We primarily do group as well, and then we do like family and couple sessions. But when we're talking like coping skills and things like that in our group sessions, mindfulness is a big one, and I think right now it's a popular one.
What is mindfulness? Because somebody hears you say mindfulness, it goes, well, that's great, but I don't even know what it is.
They're
So,
like, I have a mind.
Yeah,
What is it full of? I don't know.
Yeah.
So mindfulness is, you got me there. No. Mindfulness, it helps us stay in the present moment too, and check in with our bodies. And, you know, because sometimes things happen and we just focus on, we're so angry, right? We're so angry at this person, and maybe I want revenge, or you just sit there and dwell on it. But what mindfulness teaches us is, well, let's check in with ourselves. Why did that frustrate us? Do we feel wronged? Do we feel betrayed? Did they cross a boundary? How am I feeling?
Mm-hmm.
And are my palms sweaty? Is my stomach aching? Is my heart pounding? And it teaches us to just check in with what we're doing, how we are, why we're feeling this way, and then we process it that way. Instead of, I'm so angry, I'm just gonna lash out right now. Well, let's slow that down and let's figure out why you're so angry. Because in mindfulness, it teaches us that our bodies will tell us sometimes, that we're upset or we're, feeling certain ways. And without getting too into other things, sometimes when stuff happens, it triggers us and our thoughts go to the past. And so mindfulness helps bring you back to the present moment and remind you, maybe that you're safe, maybe it's not what it was before, and kind of helps you process it a little bit slower. Even myself, I see a mindfulness coach, and she helps me. We work on stress management, we work on grounding, making sure I don't carry any of this, the attitudes and things that my clients are having with me. And we work really hard on just, keeping my emotions and my mentality protected, since it's a difficult job sometimes. And so she helps me make sure I don't carry any of that with me.
Because I think you and I talked about one time empathetic fatigue, which is, what would empathetic fatigue be when you talked about your clients and carrying that?
Well, if you ask my sister, it means I come home and I'm a little grumpy and I don't feel like talking.
But why would that be?
Because I'm empty. You see, and you can't, like we said earlier, can't pour from an empty cup. And, not to put my whole business out there, but, my poor sister, she'll be like, is it because you've been nice all day? You can't be nice anymore. And I'm just like, I'm tired. Which is what my mindfulness coach, helps me do, is communicate that.
Mm-hmm.
Hey, I've had some long sessions today. I just need to, I need to jump in the shower, kind of relax. And then when I come out, I'm ready to socialize. Because sometimes when we take things too personal, or we carry their burdens too heavily on us, and we just feel and we feel and we feel for them,
mm-hmm.
instead of with them, then it does kind of make us, I wouldn't say it makes us feel empty, because we have feelings,
mm-hmm.
but it can lead to that burnout that, we hear a lot about. And so,
and that shows that, you weren't moving trees or doing heavy lifting.
yeah.
So when we say fatigue, but you come home and you're just mentally
exhausted. Yes.
I think that's a good example of that. It is a real thing, and it
Absolutely.
does show itself up. Because I'm the same way. We have two different careers.
Mm-hmm.
Mine's, physical.
Mm-hmm.
Yours is mental. But I still carry those with people from hearing them all day and them talk about things.
Yes,
so like Kim knows, my wife, when
mm-hmm.
I get home, I'm just probably going to be quiet. And it's not a real time to go in a deep conversation, because I really don't want to talk.
Mm-hmm.
So there's things that I've had to work on to how can I work on me so
mm-hmm.
I can show up for her.
Exactly.
So at night when I get home after a full day and have empathetic fatigue,
mm-hmm.
how can I still show up for her? So there's some things that I have to personally put in place during the day
mm-hmm.
to not allow that to happen.
Mm-hmm.
So mindfulness is a great one, and I think, and correct me if I'm wrong, it takes practice.
Absolutely, it's not easy at all, especially
because kind of being honest with yourself, right?
Mm-hmm. Yeah, instead of when we don't feel well or things happen, we sometimes may want to place the blame outward. It's I'm grumpy because this person cut me off at the red light, or this thing didn't go my way, which are all valid, but mindfulness teaches you to come look a little bit inward. Why did that bother you?
Mm-hmm.
And it helps you, really the goal is to help you brush that off a lot quicker,
mm-hmm.
and get back in the present moment and be like, okay, well, I still have a car and things are okay and the sky is blue. And just really ground you back and kind of just protect yourself from carrying too much of that. And, you brought up a good point, about going home and, not wanting to talk, because we've had clients, well, how do I get home? We've been here at therapy all day and I go home and my family wants to talk and I don't want to. And so we work on that. We talk about, well, maybe you send them a text message. Hey, it's been a long day at therapy. I'm just warning you, I need 5 minutes, and you work on those routines so that you don't get cranky or they don't lash out, but that lets them know, hey, I just need a couple minutes to myself because I've done this thing all day. And so it helps you show up for them because you're setting a boundary. Like, I'm protecting them from me getting a little cranky, but I'm still allowing myself to have those moments to decompress and relax. And then when I'm finished with that, then I can show up for them even better because I was allowed to have my time. And that's mindfulness is big on that as well.
And that's working on communicating with yourself, but also with others.
Yes.
Of what you need from them, so you can show up better. What's some other techniques or tools that somebody might use to improve mental health?
So, well, we have good coping skills, bad coping skills. They say, which I'm not here to judge anyone, but drive by the liquor store and it's like wine's cheaper than therapy, which may be the case. But might not be the best coping skill, got to watch out for that. But we would lean more toward like journaling, exercising, communicating, you're going to love to hear this, but we also talk, balanced diet, being mindful of what you eat, hydration. But journaling is a really big one that we have, and, stretching.
You say journaling, what good does writing do?
Well, it does a lot of good, because sometimes it's better to put something down than to say it out loud.
But what if somebody finds my journal?
You better hope they don't. No. Yeah, you better hope they don't,
So I'm just thinking out loud that somebody might say, what if somebody finds it? Some of the things that they might come up with. Why should I journal? What what good does it do? What if somebody finds it?
And what I would say, because I enjoy a good challenge, is, well, let's figure that out when that happens. So why don't we go ahead and start journaling now, and then if someone finds it, we'll approach that when it gets here. Because that sounds like an excuse to not start something. And so let's start it, and we'll approach that when it gets here.
And what's the difference between journaling and versus just talking about it? In other words, what's the difference between journaling on a paper versus them talking about it out loud to themselves, for instance?
Well, depending on where they talk about it out loud.
If they're talking about it out loud to themselves in a private space, same as they might be journaling, what benefit does journaling, is there some kind of something that journaling is therapeutic?
For some people, the art of journaling allows them to let it go and kind of drop it, so to speak. We've had clients that say, well, my family said I should just put these problems in a box and put it on the shelf and walk away. That's definitely, easier said than done, but journaling kind of allows you to do that. You put it on a piece of paper, you write it down, and I always kind of try to help them out of sight, out of mind for that topic. Or write it down and then bring it back with you so we can explore it when you come back. Because a lot of times they'll say, well, there's this thing I really wanted to talk to you about and I can't remember it. And I'm always like, well, text it to yourself, write it in your notes or put it in your journal. And when you come back, you'll have it there and, then we can explore it. But a lot of times really it's to help with the release, to help let go of something that, they're really dwelling on or they're stressed over, because we don't want to dwell too much on those things.
Is it better to write or type? Is there a difference? Does it matter? Or is it just an individual preference?
I think it's individual preference. Some people might prefer, younger crowd seems to sometimes like writing it in their notes. Some prefer journaling. I think that's just going to be dependent on the person, absolutely.
And I think, simplicity form as journaling it's almost as a post-it note. For me, once I put it on a post-it note, I can get it out of my mind. I don't have to think about it because I know it's written down. and I often think of journaling as that same way. You have all these things swirling around your mind. You journal, you get it out, and it's out. It's gone.
Absolutely.
It's out of the mind. So great coping skill. Any other maybe positive coping tools or techniques that, in a positive way?
Positive.
There's plenty
of negative. Yes,
yes.
And well, we have a whole program on that here. Because those negative ones are just meant to numb things, help us avoid them, throw a Band-Aid on it. And I always like to tell them, well, that's a good coping skill, I guess, for short term.
Mm-hmm.
But when you, I don't know, wake up, sober up, who knows what, it's still there.
Mm-hmm.
So we haven't really solved anything. We haven't processed it. We haven't fixed it because it just kind of slaps a Band-Aid on it. Like sleeping, because we talked about rest.
Mm-hmm.
Sleeping is extremely important. We will talk about that every single day here.
Mm-hmm.
But oversleeping, oh, I'm really tired. This is stressful. Let me go ahead and take a nap, or let me sleep for 12 hours. Well, not only, you wake up, your problems are still there.
Mm-hmm.
And so some people have good coping skills in the sense that rest is good, getting out of the house is good, but it's when they bring those to the excess
mm-hmm.
that the good stuff becomes not so good anymore. But one of the better ones we also talk about is like grounding techniques. This is good for people who might get anxious or angry, stressed, overwhelmed, and that's just piggybacks off mindfulness, and that helps kind of bring you back in the moment as well.
So, and how is grounding different than mindfulness? So grounding is
so grounding is a form of mindfulness, but some grounding techniques would be like, let's say you were feeling really anxious right now, so then you could right now, without anyone noticing, be just looking for everything in the room here that was red. And you'd be like, oh, that's red, this is red, you'd be finding all of that. And then maybe next you're like, well, I'm going to count and see how many lamps she has in here. I have so many. And so by the time you get through your list of
mm-hmm.
whatever it was you were looking for, you will notice that your heart rate has come down, your breathing has slowed, and that heightened sense of fight or flight will have come back down as well. And so grounding is used a lot for those who get really anxious sometimes. And that doesn't necessarily have to be, those with the diagnosis of anxiety. It could be getting, about to get on a roller coaster and it's your first time and you're really, kind of freaking out about it. Well, okay, let's count how many carts are on there. And by the time you get through that and you've brought all of that back down, your fight or flight system has kind of relaxed. And so it helps just soothe all of that.
And that's things that people can do, and nobody has to know that they're
no one would know.
I mean,
no one would know that you're counting, the colors in here, the lamps, the boxcars at the amusement park or anything like that. They would have no clue because that's something you can do within yourself.
So you mentioned anxiety. We hear that a lot.
Mm-hmm.
Individuals say they have anxiety, have lots of anxiety. Mm-hmm. But I'm sure some probably have been diagnosed with it. Some have not. They just say I have anxiety. Mm-hmm. And I think we hear that more and more. Mm-hmm. I'm not sure if that's because it's more prevalent or people are just more aware of it. Mm-hmm. What are your thoughts on anxiety? Because I think a lot of people, I mean, I don't know if it's a common one, but it's when we talk about mental health, I think a lot of people think about anxiety.
I think that's because anxiety has become so normalized for us, which is not wrong. I love to tell our patients, anxiety's been a thing since like the caveman time, and they laugh at me because I don't really know much about that time. But I like to use the example. It helped the cavemen know they have to run from the bear. Mm-hmm. It helps us know we shouldn't touch something that's hot, or that dog's growling. We might not need to pet it. So that general sense of anxiety, it's not a bad thing. Mm-hmm. And we talk a lot about that anxiety it's not bad. We shouldn't be embarrassed about it. It doesn't make anything wrong with us. And so I think that's why that one is so widely known, widely talked about, and easier sometimes for people to acknowledge because we all have it. You know, I'd be hard pressed to meet someone who says they've never been anxious. And so I think that's why that one is a lot more heard of, more talked about, is because it seems a lot more normal than some of the other things people would struggle with.
And what happens when, those fight or flight, those go into, now it's keeping people from doing things?
That's when they come see us. Yeah. No, it just depends, because fight or flight can be triggered for so many reasons. Aside from anxiety, there's trauma, and that opens a whole nother door. But that's when people should start coming or consider, looking into therapy when when we go back to mental health and we talk about, how that's your physical, your mental, your social, your overall well-being. Well, when some of these stressors or anxieties are getting in the way of that, to the point where maybe you're not leaving the house, you're not going to see family, you're grocery pickuping instead of going in and saying hi to everyone, you're not getting out of bed as often. When it's truly getting in the way of living, that's a good sign that it's time to do something.
And are there individuals that have anxiety but they're high achievers, high performers?
Yes, I mean, yeah, because like I said, anxiety, everyone has it. So the CEO, before he gives a speech, there's a good chance his heart's pounding. Oh, whoops, microphone.
Right.
His heart's pounding a little bit, so I think there are plenty of people out there who have anxiety. It's just maybe some can manage it better than others, and that's not to say someone's weaker or stronger for it. It's just, it's just kind of maybe about what they're used to, what they can manage.
So I texted you a while back. I can't remember what I called it. And you told me about anxiety. What was it called?
I'm laughing because I remember my first reply to your text message. I think you were asking me about high functioning anxiety.
Yes, high functioning anxiety.
Yes.
So here's the thing. So I watched this because my wife has anxiety, and we've worked on things to help manage that. Through mindfulness and talking and different triggers and things like that. We've worked on that. And so I listened to this podcast and I sent it to her about high achiever, about anxiety, because I thought that's her. And she sends it back to me and said, "What do you think about that?" I said, "Yeah, that explains you." And she said, "Do you not see yourself in that?" And I was like, "What?
Man.
Huh?"
She's such a hoot.
I was like, "Whoa, wait a minute." And so I listened to it again, and when I listened to it through a different lens, everything they pointed out was me. And I had never thought about that. And when you kind of explained it to me, it was like I read it, and then I read it to her, and I was like, that's exactly me. But it never dawned on me. I mean, like, I feel pretty self-aware.
Yeah.
But I looked at it and said, "Oh, that's her."
Well, I mean, for some, I don't want to speak too specific, because everyone's different. But for a lot of us, it's much easier to see things in others than it is ourselves, even if we are self-aware. I mean, maybe even go to say, like, super self-aware people, they may not notice things within themselves. But sometimes we notice it in others. Kind of projecting. We know we do it, but we're going to call someone else out for it because it's much easier to address their things than it is our own. Not to call you out for that, but sometimes it is easier. We have some clients who are working through some things, and one of them kind of had an epiphany this week of some of her traumas and behaviors, and she said, "Well, now that I've seen it, now that I know I'm doing it, I can notice it." She's like, "But I noticed it first in so many other people." And I'm like, "Well, maybe there's reason for that. And so, sometimes it's easier to call other people out on their bluff
Mm-hmm.
than it is to be like, oh man, that's me too.
Because, when she told me that, it kind of hurt my feelings.
Exactly.
But it didn't hurt my feelings because at first I thought it was her calling me out, and it hurt my feelings that she would say that about me.
Yeah.
But then the more I thought about it, it hurt my feelings because I didn't realize that about myself.
Mm-hmm.
But I think it was important to recognize that.
Absolutely.
So it's something I had to work through. So I think sometimes when we have those, I think for me it was an epiphany because I was like, whoa, well, who is this and what? But I think it was a good lesson to learn that even when we are hyper self-aware, there are still things that we don't see about ourselves.
Absolutely.
And I think that's the journey, that's the process of self-discovery. And by exposing ourselves to different people, different things, that's why I think, therapy is a great thing, because you could be exposed to something that you didn't recognize about yourself. And you go, wait a minute, that's not me. I thought that was her problem, his problem.
But it definitely not mine.
Right.
Yeah.
But it turns out to be maybe it's more my problem. So how do people maybe cope with anxiety?
I would say, a lot of what we talked about earlier, those same techniques, grounding is super important for those who worry about, anxiety or panic attacks. Because we do get a lot of referrals with people who struggle with anxiety, and everyone copes with it differently. It just kind of depends on what they're anxious about too. You may have people who just in general get, anxious about things, or people who maybe got overwhelmed at work, so they're having to take some time off to kind of readjust, and they get worried about finances and then their jobs and providing. And so I think it just depends, but for the most part, we like to talk about, well, what is fact and what is fiction? And is the worry that you have fact, or is it something that you've kind of catastrophized? Is it you're going to lose all your money because you're not working, or is it you're just worried because you're not working and maybe your check isn't big as it was before? And so we try to bring some of that back down to more relatable things, because a lot of times what our anxiety can do is catastrophize things and make it seem way worse than what it really is, which is, you've probably heard in some of the other podcasts before, that just our way of our brains protecting us, our minds protecting us. Let's prepare for the worst case scenario, so when it happens, we're fine.
Kind of like somebody sitting in a movie theater and checks out all the exits because worst case scenario.
Yes, and then, I know in the day we live in, times are a little different, but, all that does is feed that fear sometimes a little bit more. Because even though you do that, some people do that to find comfort, it doesn't always provide that comfort that they think it will. It just still continues to feed the worry. So a lot of the times, which I did a group on that earlier this week, about anxiety and what is your anxiety telling you? Write down the fiction. And then let's write down the fact. What is the not the actual, but, what are we actually kind of looking at versus what is your mind telling you? And so a lot of times it's just about rationalizing with yourself, But, like I said, that really kind of dives deep into the mental illness aspect of it. And that's a whole nother ballgame, because there are times where people can't rationalize. They're not there yet, because of a lot of various reasons. So
that's when it goes into, it needs really professional help too.
Yes, yeah,
to
like
be
maybe
to
you
get
need,
through.
Yeah. So besides therapy, maybe you need to, see a psychiatrist and, get some help through some medications as well. But for your, your average run of the mill, someone with okay mental health, that aren't having to worry about the mental diagnosis, then those things would work a little bit easier, possibly. But then you have the cases where it's not that simple, and there's a whole lot of other things we have to get to and work through and process before we can even get to rationalizing anything. But just for the average, I guess, listener, that would be something helpful for them.
But it's true to know that there may be some issues outside of what you can actually do for yourself
Absolutely.
that need a professional. Just like if you go to the hospital to a doctor, same thing for mental. There's things that you can't fix that you need professional help with.
Yes.
For Kim and I, when we talk about coping, what came to mind for me and her is communication. So there's things that trigger her, and I know that they trigger her. So when I see those coming, we talk about it. Or we try to divert some of those things so those triggers don't happen. But we do that through communication. So and I think that what works for some doesn't work for others. So I think again, being self-aware and mindful is what works for me. What can I do? What are some of the when individuals want to start working on mental health? What are some challenges that they might face when they're trying to work on their mental health?
It's almost sometimes like, what challenges do they not face?
Yeah.
But I think what we've seen a lot lately is, lack of support. Maybe they don't reach out for help because there's not, maybe their family doesn't agree with them, or they're worried about being judged. And, while I think the trends are showing that stigma is decreasing, not rapidly enough, though. And so I would say that's one of the biggest challenges. I don't have a statistic for that, but it is, I would say, that's one of the bigger challenges is, the fear of being judged, or, the family not being on board, or where can you go? Some communities might not have, a mental health clinic or private clinicians, which is why we're kind of fortunate to be moving toward the trend that there's a lot of online platforms available as well, where you can do them televideo. Of course, you have the politics of it, insurance, non-insured, that sort of thing. But I think really, for the most part, what I've seen, and I can only speak from what I've seen in the 7 years I've been in this field, is just the fear behind it, and being, we have people come in, I'll talk to them, and they'll tell a story, and they're crying. I'll hand a tissue, and they're like, "I swear I'm not crazy." And I was like, I didn't call you crazy. I don't know where that came from. Like, nobody in this building is crazy, and you're definitely not, and that's where I piggyback off our girl, Brene Brown. And I talk to them about how courageous they are for asking for help. Because when we're vulnerable, we're kind of in the rawest form. We don't have control over something. Somebody else does. Our emotions are kind of being put out there. And so I kind of give them that Brene Brown quote, and I tell them that, they're doing the most courageous things by coming here and being vulnerable, telling their story, and asking for help.
Because there's strength in that.
Absolutely.
Absolutely. And I think sometimes we get into issues because we hold all that in. And we don't let it out and explain and cry, and because that's not.
My favorite thing to do is to hand people the box of tissues and be like, "Go ahead and cry." Like, what? Cry? I love that you're crying. And they're like looking at me like there's something wrong with me. And I'm like, I bet it's been, for some people, maybe they were crying every day, but they didn't know why. For some people, they've held it in for so long that once they come here and they come to a place that they know is safe, and they finally just let it out, you can tell that it's just a huge relief to them. Because, being vulnerable has not been seen as something brave or strong or courageous. It's been, been shown to make people weak, or so we've been taught anyways. And so when they come in here and they get to do that in a judgment-free and a safe zone, I often see the relief just come off their shoulders when it's reaffirmed to them that they're strong and that they're brave, and they're going to be so much better for it. I don't know. It's my favorite thing to do sometimes.
Well, and I think that's one of the reasons that my next question is, why are individuals slower to work on mental health more so than their physical health. And I think that's one of those is they don't want to be vulnerable. But what might be another reason why? Because I mean, we're all quick to gyms across the country are full, and we see an increase in gym memberships in January and February. But I would probably say that there's not an increase in therapy clients come the first of the year, like there is equally to gym memberships.
Yeah, there's definitely trends, and I saw trends at my last place of employment on when we had peak times where we were getting new clients or when clients were kind of stopping services. And while I've been here, I've seen some trends as well. But I think for some people, going to the gym may seem easier because, well, I don't want to say results are quicker because, as you know, that depends. That depends on a lot of factors. But I think in most people's minds, the results will be faster. And if I go to therapy, how do I know it will change me? Whereas we've all been told you work out enough, you eat well, results are going to happen. It's a fact. But, well, I guess you couldn't say technically it's a fact. You get better in therapy. But for the most part, maybe some people just don't care for it. But that's not out there. There's not a commercial like, oh, look at me before therapy and look at me now, and what was it back when I drank Slim Fast? Look at me then, look at me now.
So it's not something you can take a picture of before and an after. Sometimes.
I mean, maybe sometimes. It could be like, look at this before, look at me now. But it's not always seen so rapidly. We hear it though when we see it. We have patients that's like, yeah, I remember when I first came here and I was depressed and I was quiet and I wasn't brushing my hair. I was coming here in sweats and I wasn't talking to anyone. And now, I'm putting myself together and I'm socializing. I look forward to coming and we can see the difference. I think earlier this week I told someone, I'm like, you were glowing today. Like, you just look so happy. And she's like, I just feel so well rested. I feel at peace now that I've worked through these things. And well, that's worth it, for her, but she came and she consistently came and she put in that work. But it's harder because we can't, slap that on a magazine or put it in the news. Like, look at this person before therapy and 3 weeks later. And so I do sometimes think that it's because it's not so rapidly. You don't see results so rapidly. It truly, depending on what you're going to therapy for, it truly does take time and effort. And it's not, going to the gym's not always pretty either. You've seen me like over on the side dry heaving. And so, yeah, that's work, but it's work in therapy too. It's not always pretty. It's not always happy conversations. Sometimes we have to process those hard things. And, sometimes it's easier to jump on the treadmill and listen to some good tunes than it is to go deep inside and look at yourself and look at the things that have happened that have led you to this point.
Because and I think that's a good point. It's things have led up, and sometimes we just say, "Well, I'm here, and I don't like it." But when we, I think, dive into it, there's reasons why we're here.
Absolutely.
And if there's reasons why we're here, there's reasons we can get out. We can move on. Just in finishing up, what are what's maybe a trend in mental health that we should be aware of, or trends?
Oh, our favorite thing, TikTok. TikTok.
What does that have? How does that affect our
mental health?
Yeah.
Well, I think with social media, really in general, it has opened the door to people talking about their own struggles. They're making these clips, these videos of being vulnerable, or you have other clinicians themselves, making clips, small clips with advice or, tips, tricks, that sort of thing. And so I think with the trend of people being so vulnerable online or clinicians reaching out to audiences online, that has opened the door to making mental health, mental illness a lot more real, an open conversation, an open topic. And with that, it opens the door to the fact that a lot of places are moving toward the online platforms, where if your town doesn't have a clinic or a private practice, then you can look up some of these online platforms and try to find someone, that best suits your need. Now, not all platforms are great, and that's not for me to nitpick,
but people have to do their due diligence.
Yes, people
and
need to
again find the reputable ones, find people to
Yes.
connect.
Yes,
Whether it's in
and
person.
scrolling through TikTok, liking a video that's not doing therapy, even if they're giving solid advice. I mean, even myself, I've been scrolling and I'm like, oh man, like that's great. I like that. And I might build off that for a session or a group, but that doesn't count as a session,
Right.
therapy. But, people do still need to do their work and make sure that these places or the people they're looking toward seeing have the proper credentials are, because therapists, we're great. But, I might not be able to help someone with a certain need if I'm not, if I haven't had enough hours in that, or I don't specialize in that, or I don't work a lot with that population. So it's really about finding that therapist who works with your needs. So that way you can hope that the fit is there. Absolutely.
And and you mentioned before about consistency, and that mental health, just like physical health, has to be consistent. It's going to take work, and being consistent means you don't just do it when you think about it. Because what happens if we exercise just when we think about it?
Then I'll miss the gym like I did today.
Not throwing you.
No, yeah,
but we're not as healthy
as
we should be because we're not making it a priority.
Absolutely.
And like you mentioned earlier, mental and physical and emotional, all those things intertwine.
Absolutely, they're all connected. Absolutely.
So, why do you think people just don't spend as much time on mental health? Is it just because they don't want to look at it? They don't know how? It came to mental health, and if there's one thing you could do today, just one thing that would get them started, what would that be? Just something that would get them started and say, yeah, I'll do this until I figure something else out. Something that could
that was a lot of questions in one.
Let me back up. Let me make it more simple. What's one thing that they could add to their daily routine to be consistent? Because a lot of times we're not consistent because it doesn't fit our lifestyle. If I did maybe all the things you did in mental health, it wouldn't fit my lifestyle and I would fall apart.
Yes, absolutely.
And if maybe you did everything that I did physically, working out wise, then you might not stick with it. So
heck no, I'm not waking up at 3 o'clock in the morning.
No. And see, that's an individual thing.
Yes, absolutely.
See, that never worked for you.
Yeah, no, it would not. Yeah. I barely make it at 5. 3's not happening.
So maybe what's one thing that somebody could add to their routine that would make them more mindful of being more mentally healthy?
Well, I'm going to answer your other question because I feel like that answer was important.
Okay.
But I feel like people don't work on it as much because it's not as glamorous, and sometimes it's not. It's not as pretty. It can be. It can be emotional depending on what you're doing. Now, if it's just your run of the mill, I'm stressed, I need to straighten out my priorities, then that might be different. But I think that it's not worked on as often because it's work, and emotional and mental work can be just as exhausting as going to the gym, lifting weights and training. But I think something that anyone could do to maybe help, lighten the load, get a good balance, would just be to examine their life as a whole, in certain areas, social, family, career, and look at it and see if it's balanced. And if it's way too much things going on career, nothing in family or nothing in self, then look at that and see where you could find a good balance. Because if we're giving everything to our career and not enough to ourselves or our family or friends or what have you, then we may be reaching burnout, with that. So I think just a good overall life examination of where you're spending your most time and where you want to be spending your most time, and just try to look at that and see where you could find balance. But my biggest thing that I've been telling people since I started here is if you want to learn how to create a routine, and I think I stole this from you and Lewis Howes in science, is make your bed.
Why?
Because number one, I feel like it's an easier habit, like tuck it in, put the pillows. And I talked to them about how when after you've had a long day and you go to your bed and it's made, it's a relief. Like if your bed is made, hopefully your room is clean, but whatever. And it's almost like your life is put together.
Mm-hmm.
You go in, you go see this bed, and it's well made. And I always tell people, you don't have to go iron your sheets, just make it. Make it look okay. Then it kind of tells your brain that you're put together, that things are going to be okay. It's a cornerstone habit. Once you can consistently do that for a long period of time, then chances are you can build from that into other habits as well.
So is that what a cornerstone habit would be? That it's a habit that you can build upon.
Yes, absolutely,
Mm-hmm.
absolutely. I always, when we're in group, someone will say something and it'll remind me, and I'll be like, "Pop quiz," and they'd be like, "Oh," and I'm like, "Who made their bed today?" and so it's funny to see those who have been here long enough to know,
Mm-hmm.
and they're like, "I did, I didn't forget," and then the new ones, they hear the explanation. But I'll never forget we had a client, and I would always be like, "Who's made their bed today? Why not?" And if it's made, chances are you may not nap in it.
Mm-hmm.
And
it's true.
We're not big fans of naps sometimes over here, but and so you don't want to mess it up because you took the time to make it. And this client I had been working with in group and individual, it was so funny because he told me it had been a while, and he's like, "I just want to tell you something," and I was like, "What's that?" He's like, "I'm so annoyed with you," and I was like, I'm sure I had that coming, right? And he said, "I cannot leave the house without making the bed." He said, I cannot do it. I will be late if that means making my bed." And I said, "Good. I'm so glad to hear you're annoyed with me." I said, "Because now we can build off that. Now, now you have been starting other habits. Now you're doing these other things." I said, "So while, yes, I nagged you for a little bit, I was like, 'Did you make your bed?' I said, 'But how good do you feel?' And he's like, 'But I do. I go home, and even if I've had a crummy day, even if I don't feel good, I see that bed and I can just, it's like a sigh of relief because it's like, I'm doing okay. I've made my bed. I'm doing okay.'"
And it's just, we think the bed is such a simple thing.
Mm-hmm.
And when we talk about, I think, mental health and working on it, it can be the simplest of tasks.
Mm-hmm.
I think we need to overhaul, we need to do this. It doesn't mean that we need to go see a therapist necessarily.
Yeah, no,
maybe it needs to start with the simplest task of making our bed. Because like you said, when he got home, he just feels so much of a sense of wellness and, at least this is done. My day went to chaos, but this bed is made when we come home to it.
Yes.
And I think that's just so important that just the simplest thing, find that simple thing for you.
Absolutely.
What's that simple thing that's going to make that you can put in your day, make part of your habit, make part of your routine? That is the most simplest thing. That now it becomes a non-negotiable habit.
Exactly.
I'll be late to work to get that done.
Yes.
Now, non-negotiable, just like I'll be late to work to make sure I brush my teeth. It's those type of habits. And when we start extending those habits, we grow, and I think we grow in confidence because you grow in knowing that I'm a person that makes his bed or her bed. And I'm a person that leaves the house feeling good about that. I'm a person that gets home and feels successful because I had my bed made. It's not messy, and it's just a good thing. It's simple.
Absolutely.
I think sometimes we make it complicated.
Yes.
Just same thing as physical health. It's not complicated. Go out for a walk.
And the deal is those simple things, that we talk, making the bed and brushing your teeth, what have you. Those are sometimes the first things to go when we start to feel unwell. When we had we woke up, we didn't feel good, so we didn't make the bed that day. Okay, that was one day. And I always tell the clients, you get one day. Tomorrow we're going to get it together, right? And because those are the first things to go when our mental health starts to struggle. So we didn't make the bed, or maybe we didn't brush our teeth, and then it's been 2 days we didn't shower as much. And so it's the small things that we use to build up and to feel better, but those are the first things to go, and are sometimes the signs that aren't as quickly recognized that we're not doing as well. And so that's why we build up on them and teach them, well, when these things start to go, let's check and see what's going on so we can see what we need to tweak a little bit.
It's the simple things that can help your process build, but it's also the simple things that can be signs of not doing well.
Absolutely.
So it's all in the simple things.
Yeah, and balance and maintaining some of that. Yes, absolutely.
Yeah. So you share with me a lot of different resources that people would have, and I'm going to put those on the show notes so people can. You gave me websites that people can go to for different things. It's a good resource, and sometimes we don't know where to start, so just start there. And it'll lead you somewhere else, and just be mindful, do the simple things, be aware of the simple things when they go away. It's okay to get therapy.
Yes, absolutely.
It's okay to have counseling, whether it's individual, whether it's couple, whether it's family. Yeah. We all have issues.
Definitely, yes. I mean, and it doesn't always have to be for a long time. It doesn't. It doesn't. Therapy isn't forever. It's not meant to be forever. We don't. While sometimes I really enjoy my clients and I'd love to keep them forever, that's not what it's meant for. We don't want to keep them for a massive amount of time. The goal, depending on their mental health diagnosis, if there is one, is to process what we need to process to help them work through that, so they can be successful without us, because the goal is for them not to need us anymore. But it is, I mean, therapy is great. I think everyone could benefit from it in some form or fashion. Absolutely.
Well, thank you, Monica, for joining me today. It's been a pleasure all these years to see you grow into what you are and helping so many. We help others. Both of us help people in different ways. You in mental, me in physical. But it's been wonderful to see you take those steps and moving on. I know your career is going to keep going. That's why you keep getting more degrees and getting more school and more certifications, because you just want to help more people, be a better service to people. And I appreciate that, and thank you for that. So thank you for being on the Mind Body Project.
Well, thank you for having me.
You're welcome.
It was great.
And hey, we'll see y'all next time. As I tell my wife Kim every night before I go to bed, it's Ball of the Night, AA, out.